Hi guys! Hey, if you like this video, please click like. And if you'd like to see more of my videos, please subscribe. It would certainly be appreciated. Thank you! Hi guys, it's Mama Eadie, and how are you today? Mama Eadie's doing much better, so we're in a happy spot right now. Today I want to talk about dog lesions, and I don't know if you know what they are, but we're going to explain them. They are like a skin ulcer or erosion. Erosions are shallow defects in the skin that only affect the skin's upper layers. They can be quite painful, but tend to heal quickly in the skin if the skin is protected and the underlying cause is eliminated. With ulcers, the surface layers of the skin are comprised completely, since the defects go deeper into the skin. Ulcers require careful wound care to prevent infections and tend to heal slowly. Erosions or ulcerative dermatosis, disease of the skin, are from a group of dissimilar skin disorders characterized by the presence of erosions or ulcers. The symptoms are erosions or ulcers. They may be found anywhere on the body. Hair loss, single or multiple lesions. Lesions may be inflamed, indicated by redness and swelling. Lesions are overpressure points where skin lies closest to the bone. Dry discharge on the surface of the skin, like a crust, and may have moist discharge oozing from the lesion. Loss of pigment in the skin and or hair. A variety of conditions can result in erosions of the or ulcers of the skin. Common causes are burns, trauma, skin infections, as well as more complicated conditions such as drug reactions, certain types of cancers, and autoimmune disease of the skin. Viruses can also be cause of erosions or ulcers and can appear identical to burns or trauma. Your veterinarian may need to run a battery of tests including blood work, cultures for different types of infections, and skin biopsies. So it's a sample of skin tissue to determine the root cause of the reaction and prescribe proper treatment. In some cases, an underlying cause cannot be identified. Your veterinarian will diagnose this outcome as an unknown disorder or disease. Immune-mediated disorders, inflammation of the blood vessels, canine juvenile cellulitis, I believe it's pronounced, cellulitis, also referred to as puppy strangles. That I've heard of. This condition is characterized by swelling of the head, neck, muzzle, eyes, ears, and the skin will crack in response to swelling with the swollen lymph nodes drawing through the skin and leaving crusted lesions. Toxic epidermal necrosis, tissue death, usually medicated induced. These are still immune-mediated disorders. Feline indolent ulcer, an inactive, slow-healing lip ulcer that causes little to no pain. Also called a rodent ulcer, but is not related to rodents, usually caused by flea bites, sensitivity, or food allergies. And the last one, I'm not even going to pretend to be able to pronounce, but it's an autoimmune disorder in which the immune system attacks the skin. Infectious disorders. Skin infection caused by staphylococcus, characterized by the presence of pus. Deep fungal or mycotic parasitic fungi infections, such as, oh my goodness, well, you get the idea. It's a deep fungal problem. Superficial fungal infections, bacteria such as Nocardia, streptomyces, and antimycetes indicates an active... Boy, these words are ridiculous. But anyway, it's all in the infection area, and I'm sorry, I can't pronounce these words. Parasitic disorders, like flea bite allergies, mange, that kind of thing. Also, congenital or hereditary disorders, various skin disorders in which the skin is abnormal at birth. That is a thing to check out, and that may or may not be inherited. Metabolic disorders, excessive products of steroids by the adrenal glands, and especially when complicated by secondary infections or calcium deposits in the skin. Cancer, mast cell tumors, lymphoma, that kind of thing. Nutritional disorders like zinc-responsive dermatosis and generic dog food dermatosis, allergic to specific ingredients in that dog food. And then miscellaneous is the thermal, electrical, solar, or chemical burns, frostbite, chemical irritants, or venomous snake bites and insect bites. So there's a lot that can cause lesions. Let's just put that away. And your veterinarian will begin with your dog's full medical history and a physical examination. This is especially important owing to the extensive differential list. Many of the causes have subtle differences in appearance and distribution. Lesions, ulcers, and blisters will need to be biopsied for a depth analysis. Your veterinarian will perform a histological skin biopsy and analyze the diseased tissues as well as microbacteria and or fungal cultures, and evaluations of fluid and pus from the lesion or blister, and sample of the fluids. Subsequent microscopic examination of the involved cells in the fluid will also be used to determine the presence of bacteria infections, either aerobic or anaerobic, which means bacteria that can live with or without oxygen. The treatment will be given on an outpatient basis for most skin disorders, but methods of treatment and medications vary. Your veterinarian will tailor a manageable program that is best for your dogs. Individual case, if the cause of the dermatosis is known, specific drug therapies may be prescribed. Some of the possible methods of treatment will be hydrotherapy, which can be applied with either a whirlpool bath or by spraying cool water under pressure against the ulcerated skin. First, make sure that your veterinarian approves of the hydrotherapy as appropriate for your dog's condition. Avoid the temperature to apply over-the-counter creams and ointments to erosions and ulcers without first checking with your veterinarian, since some commonly used products, such as those containing neomycin, can actually cause a delay in healing. So be careful with that. Other products may contain alcohol or other ingredients that could inflict pain when applied. Keeping eroded or ulcerated skin clean and protected with soap that is specifically formulated for sensitive skin will be a key to effective and responsive healing. Follow up with will be on case-by-case basis and will depend on the disease process. Follow-up care with your veterinarian is important, especially for slow-healing ulcers. The progress of wounds should be monitored at least every other week to be sure that the healing is proceeding properly and that the infection has not further complicated the healing process. The reason why I'm doing this particular session is there's a beautiful Great Dane, Victor, who is got lesions and is not expected to live. But he's doing pretty good right this minute. Today he got a bunch of toys. Yay, Victor. And I just wanted to put this in for him, dedicated to Victor. And so I hope you guys will bear with me on this one. I love you guys. I love Victor. I love my fur babies. Please subscribe and bye-bye!
What is all this, baby? That's a good one. And look at all the toys, baby. Look, and there's a lammy. Oh, you don't even know what to pick. You don't even know what to pick. Where'd you get all these toys? Where'd you get all these toys?